And we are live. We are live, people. Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. It's Tuesday night. As promised, we are live, and I'm live with you. And hopefully we can get some talk going on till about 30 minutes as I get my phone and see if there's anyone on tonight. So that awkward moment, a few minutes of your video when you wait for someone to come on and chat with you. As I'm sitting here by myself, it's a good thing. I like the person that I am. I can have a conversation with myself and it's okay. Don't want to do that for too long, but we shall see. So let's get a little bit more light, brighten up the place. Let's see. Ooh, look at that light. Yes. Just bam. Okay. So I'm just going to sit here on this Tuesday night by myself. Maybe I'll sip a little tea. I got the tea. Oh, it's chamomile. Sweet chamomile tea. So let's see. Come on, people. It's Tuesday night. It's February 2nd. Let's see. I thought maybe look at my screenshot there. Let's put this down and see. Okay. Maybe I'm gonna have to start doing some singing. Oh, I think I have some company on the live. So let's see how we do this. Oh, I get so excited. I'm waiting for my favorite student. Let's do that. Somebody come on and leave. It is. It's the second day of February. It's a new month. February is the beginning of Black History Month. Black history should be every day. You should celebrate the richness of your heritage, including the struggle and the strive and the success. And I don't know how to theme with the S. My favorite student is on. Hey, Cody, welcome, welcome, welcome. The stars are a little crazy tonight, but beautiful as ever. So definitely want to keep. Hey, Milana. Oh, hey, Milana. How are you? It's so funny. I telling you, I love that I still know. That's you. Got you. Got you. Milana, how are you? You're moving ahead. Is it the third semester you're in now? Because I'm so Milana must be like third semester. Because I mean I'm a bit confused. Cody, what do you have tomorrow? I'm good. Yes, 201. Okay, go for it. You've made it over 102. I'm not going to say that the third semester is easy by any means. It's just that you've gotten, I'm moving the light away because I'll probably start sweating so much in a minute, plus I'm drinking some tea. It's that, 102 was challenging as it's supposed to be. We expect you to build on the stuff that you had. So don't fall asleep. Don't fall asleep in 201. Still push forward with that same strength and determination that you'll do. Queensborough, our students still, I keep things, so I don't know how these stars do with all the lights. I mean, the lights just make the place hot like ever, Look, it's like 2 minutes in, I'm like sweating already. But anyway, so how's everybody doing? Tomorrow, AMP lecture. Do you have any suggestion how to study? So you have anatomy, this is AMP 1, Cody? I think we talked about it. I think this is AMP 1. I may have to turn on the fan in a minute because it's a hot minute. Yeah, if it's AMP, yes. Okay, so here's the thing about AMP 1. As I think I mentioned to my group of students, Cody, this is what you do. First thing, tomorrow you sign up for tutoring. Sign up for tutoring before all those tutoring spots get closed. I'm telling you, do not wait until your first exam. Go to the tutoring, sign up for that tutoring, go for the first one, and say it's not for me or whatever, do not wait until a week before the exam when all the tutoring spots are closed. So I would do that right. I mean, tutoring is now it's virtual now, or it's virtual. Um, are any of the AMP labs on campus? Because I do know there's one or two. I mean, nursing fundamentals is on campus. I don't know. Yeah, sign up for that tutoring, baby girl. Do not look at it like sweating already. You just sign up for that tutoring right away. Like I said, sign up for it. Have an appointment. If you change your mind or you go the first time and you feel like it's not for you, then that's fine. But I'm telling you, tutoring gets booked, especially right around the exam. So you could do that. AMP, of course, your first anatomy and physiology. Unfortunately, it is a lot of memory. It really requires a lot of memorizations in the beginning, but depend on your instructor and how they teach. So a lot of the other courses outside of the other courses, the humanities, the sciences, a lot of the STEMs, they also include some critical thinking. So it's not that you're just memorizing, which bone is connected to what bone. You have to do that as well. You have to do some dissection. I think, I don't know, do you still dissect a cat? I mean, virtually, what are you going to do? But there is some critical thinking involved in systems. So, that's part of the reason why we look at a student's science grades with more scrutiny. Not that English isn't important. You have to be able to coin a sentence, put a noun, verb, together to form a sentence to make a statement. And that's important. Communication is important. But you also you're going to care for the human body. Not everything in medicine or nursing require you to speak. Some things you have to look at. You have to analyze it, by yourself. So you do have to understand that, the heart and the lung to me is one organ. I mean, I swear, I always teach students, look at the heart and lung as one organ. I mean, I know it's really, two organs, but you know what students are going to memorize? They're going to look at the lungs and they're going to try to memorize, right, Milana? They're going to try to memorize which lobe, which side has 3 lobes versus which side have 2. In the big scheme of things, it's important, yes, but do not spend 5 minutes on that. Patient's not breathing. It doesn't matter which side. Right now, when you get to 201, where Milana is, and emergency care, it's going to make a difference. Left-sided heart failure, presents with more respiratory, it's more of a lung issue, whereas right side heart failure could be also short of breath, but those individuals may have the jugular vein distension, peripheral edema, so, the blood is going to go back where it's, if the heart's not pumping effectively, the water is going to go back to where it was coming from. So left side heart failure, that blood fluid is coming from the lungs. So respiratory symptoms for cardiac problems. Right side heart failure, jugular vein distension, blood is coming back from the brain, blood is coming up through the vena cava. So, so students who get that, so you do have to do some of that in anatomy in the beginning. So you have to memorize some of those stuff. The brain, and again, I don't teach AMP, but I do love science. The brain. I mean, is it important for you to know where the cerebellum is versus the temporal or parietal? I mean, it is. It is. And when you learn neuro, and particular with CBA, TBA, traumatic brain injury, whether it's a brain tumor, based on the patient's symptoms, could give the provider, be it the neurologist, the emergency technician, the nurse practitioner, you, that savvy emergency room nurse, say, well, wait a minute, this patient is suddenly having issues with their vision. Well, what part of the brain controls vision? When they do this CAT scan, they're definitely going to look at everything, but I guarantee you they're going to pay close attention to whatever shade of gray is around the area that controls vision. So that's how some of this memory helps, the average nurse doesn't read CAT scan. It's not part of your scope. I've looked at a few CAT scan. I've had some physicians help me understand some of the stuff they look for. And I said, basically, you're comparing shades of gray. Like, okay, so this side is, whatever. There's more involved. So Cody, yes. So again, my tips for you, as I titled this tonight, your plan for success. Your first and foremost, you want to set a goal. You want to set a short-term goal as well as a long-term goal. Most people set the long-term goal. I want to be a nurse. That's a 3-year plan, and that's your long-term goal. Your short-term goal could be, I want to be accepted into the nursing program. Again, to me, that would be like your middle goal. To be honest, your primary goal, Cody, for you right now, you want to get, say, a B. You're going to study for an A. You're going to study for an A, but you're going to set a short-term goal. I want to pass anatomy and physiology with a minimum grade of a B. That's a realistic goal. Okay. Write it in a piece of paper, write it in a note on your phone, write it in lipstick on your mirror. Well, you have to clean that, right? So set a realistic goal. My short-term goal, my plan for success is I'm going to pass anatomy and physiology with a minimum grade of a B. That's an excellent plan. You're going to study like it's your final exam, and you're going to shoot for an A. And why do I pick a B? Because you need minimum. You have to pass it with a C, but the GPA that's required, total GPA in the prerequisites that's required for Queensborough and most programs, is a 3.0, which is a B. So why not shoot for a B, minimum B, with all your grades? See? Write it down. I'm telling things for some reason. Find a pen. I was still hunting around for a pen. Write it down. Stick it on the refrigerator with a magnet if you still have that. Milana, you got company. Irina. It's good to see you. I had to come on tonight. Good to see Cody. I don't know. There's somebody on here that that favorite student thing. You might have some competition, girl. Well, this semester she's a nurse now, so she's not a student anymore. So it's all yours. It's all yours. I'm so happy. I'm so happy to see some names that I know. It's such joy. And I'm sure. So again, back to your short-term goals, your plan for success. You want to minimum. You're going to say to yourself, of course, I know all you students do. I'm going to get an A. I'm going to get an A. And I'm not telling you not to shoot for that. That could be your mid goal. So what you need to get into, Cody, I keep telling you, there's always a favorite. And teachers who say that, they're not so true. They're just, you know what I mean? But Cody, you got this. You're good. Yeah, you're good. You're good. She's a nurse already, so she's good. You still got your crown. Yeah, so you want to get that. So Cody, you have a couple goals. And of course, you have mid-semester goals. Listen, all the students who say, I want to get an A in A&P, or I want to get an A in whatever nursing course. Yeah, Cody. Cody was no, Cody was secure. Cody got that. Cody has that forever. When I get to 100,000, because there's some long-term goals to get 100,000. Listen, when I get to 100,000, I have my YouTube plaque in the back with that little play thing. Cody will forever be my goals. Listen, you have to set. You don't set any goals, you don't achieve anything. I don't believe in luck. I don't believe in that. I mean, think about that. If you're planning on having $1,000 in your bank account, right? You said, my goal is I want to have $1,000. I want to have 1,000. And you keep telling yourself. And one day you look in your bank account and you have $999. And all that's missing is that $1 to get there. You're going to work so much harder just to get there. You have to set some goals. They just don't happen random. You have to, trust me, I'd like to go to Mars. I mean, honestly, if they're like, sign me up, I'll go. I would go in a minute. I wouldn't, they're like, we want to pick a teacher to go on the space shuttle. Oops. My hand would be up and I'm out. I'm like, later, I love that stuff. I mean, come on. But anyway, so your plan for success. I mean, you're already here. Plan for, Cody, just watch. When I get to 100K, when I get to 100K subscribers, I'm telling you, that's all that's going to, I mean, I usually have a plant in the back. That's all that's going to be back there. You're going to see my big little YouTube plaque with that play. I'm like, what? I mean, honestly, seriously. I you have to have a little laugh with this. So yeah, so short-term goals. Um, you set that, and then you work towards it. What are you going to do? Don't wait until the night before the exam to study. I mean, A&P, you have too much at stake. It's not an elective, it's a requirement, so you can do that. And then you move along. Then you may talk about the packs and certain things like that. But you guys got that. Look at Milana, you got awesome. So I'm trying to figure. So we talk about your short-term goals, your long-term goals. In order to move ahead, you have to do some type of reflection. What has helped you in the past? We talked about, did you study in groups before? Did you find it helpful? If it's helpful and it helped you move, forward, fine. If not, perhaps you need to seek something else. I used to study. I like to study by myself. I like to study in quiet because I have so many conversations going on in my head. So I would study by myself. I would have the TV on, but unmute. It's a weird thing. It's just having the TV on seems like there's somebody else there, but just quiet. So it's just it always worked for me. And like in my car, just certain things you have to find. Think of the things that work for you. In my car by myself, driving, the stuff that just comes into my mind. And again, it's probably back to that same thing. I'm alone. There are people around, so I'm not lonely. It's weird. It's weird, but I figured that out. I've always known that I can read and teach myself anything. So if the teacher is not effective, or the teacher just reading from the PowerPoint slides, and I'm going like, yo, I can read. I don't need to sit here and listen to you read. I'll probably just doodle, as I think I mentioned before. But I'll go home and I'll read it, and I'm able to process certain things for myself. I was looking for my Rubik's Cube, and I was telling people, anybody here has ever solved a Rubik's Cube? I never really gave it much thought. It's been around. And I'm like, whatever. So I'm like, one day I'm like, oh yeah, I'll figure it out. And of course, I started to do it and could only get one side completed like everybody else. And then I started watching some videos on YouTube, and some of them, they're excellent gamers, but some of them are not good at teaching. I found this one gentleman. He's kind of cute looking kid. And I watched his video, and he lost me. I mean, I got to the, maybe the second row, the technique that they show, it's, you do it row by row. You start with the daisy, you make the white cross, you do whatever. And he lost me. And I watched that video again and again and again. And there's some type of skip in it. So I put his on pause and I went to a different video. And this person, between the two of them, I solved the Rubik's Cube. I'm going to say, if I really sit down and really focus and just get all the distractions, I probably can solve it under 2 minutes. Yeah. I mean, it's crazy. It's like the first time you do it, you're like, yo, I solved the Rubik's Cube. But, don't think that people are just standing there and memorizing what turns. There are rules. There are rules, and there certain, you have to memorize certain things. If it's turned a certain way, where to put your hand, but I don't know what I did with my Rubik's, but yeah, so I now have like a Rubik's Cube in my hand all the time. So maybe for, I have a lecture tomorrow. Maybe I'll have my Rubik's Cube, but it's such a cool feeling that, I solved it. And then you start being a show off, typical, like, can I show you how to do this? But anyway, so enough talking about me. Lavina, tell me something. What's going on? What's your plan for success? I think Cody's on point with her plan. Cody's already going to go for tutoring. Cody's already asking tips on tips on how to study. If you know anybody who has passed anatomy and physiology, talk to them. I'm sure you did your homework. Who did you want to take in biology? I don't give those advice. Um, they're my colleagues, but I would tell students honestly, this instructor, to the best of my knowledge, he or she will have you do certain things that you may not see um, where it's going, but as a nursing faculty, what they're having you do currently will help you further. I mean, a course such as microbiology. I mean, can you imagine what an amazing time to be talking about everything, sadly, with COVID and every other types of viruses. So students should look at microbiology more than just, I need to get a C to get into a nursing program. You should be really looking at microbiology to really understand germs and even virology. Understand, just really how that goes, and imagine how this thing affects it. I'm totally over it though. I'm so done with COVID. I'm like, but it's going to be with us for a while, as all viruses are. And I'm just hoping in everything that we're doing, we don't forget about the other viruses and the other things that can affect our human beings. So, Sylvie, Irina, talk to me. What's going on? How are you? Tell me something other than nice to see you. It's nice to see you too. Because I'm looking down on my phone here. Maybe Irina just signed on and left. Cody, you still here? Are you at work? Um, I'm trying to figure if there's anything else I can think of going on. I think everybody's had it today, right? So Cody, you're definitely my favorite student, for sure. Since I think we're okay, I don't want to keep you too much since you have A&P tomorrow. Lavina, I hope you have a good day. And Milana, I'm so happy that you're in 201. You're almost there. I don't know what 201 is now. Is it peds and OB? I'm not 100% sure. It's been a while. I used to teach in that semester a long time ago. Yes, Cody. You see, that's where my favorite student. So I think it's just us. So I think maybe so I'll end a little early tonight. So Cody, you have A&P tomorrow. You have lecture tomorrow, and I want you to do well. Holler at your girl once in a while. I think it's good. I think it's really, really good. Today's what? Tuesday. How's the snow? How's everybody in the snow? That's the other thing. I have family in Canada, so when we get snow in New York, they're not exactly sympathetic, because they get snow in July. So they get snow in July. But anyway, so I'm glad a few of you came on. I'm always happy for a dinner party of 4 or 5, or listen, if only one person comes on, I'm totally happy about that. So I just want to make sure I'm missing whoever names I'm not missing. Milana, good to see you. Cody, Irina, Lovina. All right, so listen again. So this is just a simple video. Plan for success. Whether your success is to get into the nursing program, whether your success is to pass a course, whether it's to graduate a college, whether it's to eventually pass the NCLEX and get a job. Set a plan for success. Seek out a mentor, seek out a tutor, talk to your professor, holler at your girl, send me an email, send me a message. If I can give you some advice, guidance, I'll do completely gratis. All right, so I'm hoping all of you have a good night. And as always, you know how I end this. Thank you so much for coming. Thanks for supporting my channel. If this is your first time to my channel, welcome. I hope you stay. Have a good day. Bye.